Hi, I'm Sharon Wolf. I will be presenting on, I've actually used IDELA in many capacities, so I'll just be presenting on two projects specifically today that have been using IDELA to help inform quality improvement at a system level for early childhood education in Ghana. So pre-primary enrollment rates are on the rise internationally, but as a region, sub-Saharan Africa is still some of the lowest rates, around 20% of enrollment in pre-primary education. Ghana is an exception to that. In 2007, the Ministry of Education added 2 years of pre-primary education to their universal free basic education system, and so have some of the highest enrollment rates on the continent. The Ministry of Education did a overview analysis of the sector in 2012 and concluded that in addition to increasing access, quality improvement was really the key area of focus that they wanted to focus on over the next few years. And also getting teachers to use the KG curriculum. KG is kindergarten, that's their pre-primary, the 2 years of pre-primary education. And so I work on two different efforts to this end. The first is called the Quality Preschool for Ghana program, which is working with teachers who are already teaching and providing in-service teacher training and coaching. Many of these teachers don't have beyond a secondary education degree, even, particularly in the private sector, but even in some of the public sector schools. And so training them on the curriculum and on more play-based and child-centered approaches was a priority for the Ministry of Education. And so this project was in the greater Accra region in Ghana, and we assessed, we were in 240 schools, around 450 teachers, and we collected data using IDELA on about 3,400 children. The second project focuses on the pre-service end. So the government is actually building up a pre-service track for kindergarten teachers. 7 of the 40 colleges of education currently have a pre-service track. And Sabre Trust, a nonprofit organization, partnered with one of those colleges of education to develop and evaluate a program to support student teachers. So after the coursework, they have a year of placement as student teachers. And so I've been evaluating that program as well, both via randomized control trials with IDELA as really our primary outcome. We've measured lots of other things besides IDELA, but very broadly, the theory of change for both of these programs is that the teacher training will improve classroom quality, the nature of teacher-child interactions, teachers' own professional well-being, very high turnover rates in the sector, and particularly in kindergarten, but that ultimately those changes will improve children's school readiness. Now, I only have 10 minutes, so I'm not going to tell you very much about all these projects, so if you have more questions, we can talk later. So I'm actually just going to skip to what we found when it came to assessing child school readiness outcomes and how we're using that to inform program adaptation and next steps. So the in-service teacher training program, that's the Quality Preschool for Ghana, we found impacts on teaching quality, reductions in teacher turnover, and then we found improvements on overall IDELA scores. So I'm going to show you these impacts. Each bar is an effect size, so that's the treatment compared to the control group in standard deviation units. And what you can see is when we look at the overall IDELA composites, we used 4 of the 5 domains in this study. We saw positive impacts at the end of the treatment year and then 1 year later when we followed up children when they were in their next year of school. But when we broke it down by domains, we got some really useful information. So we saw that most of these improvements were really coming from social and emotional development improvements and not from academic skills. And so while those, they are positive effects, they're not statistically significant. And so given the background and training level of the teachers who are currently in the sector, we are now making some adaptations before expansion and scale up of this program to adapt the training to include also a focus on some basic content knowledge. We did a reading exam for teachers, just a little skill test, and the average score was less than 50%. So we realized that we need to add some additional content knowledge to the training. So that's one example. The pre-service training, this is a program for student teachers. We followed these student teachers who were randomized to receive this FTTT program or not, and we followed them in their placement year when they became full-time teachers. And we saw some changes in teaching quality, and then we assessed their students as well in the fall and in the spring. And we actually found that there were no impacts on IDELA scores across all domains, which was very useful to see that teachers actually were not able to take the skills that they learned from the training and bring them into the classroom with them when they were placed around the country. What we also found was that in schools where teachers were placed in pairs or 2 or 3 teachers, we did see gains in learning over the course of the year for their students in early literacy, early numeracy, and social emotional development. And so we've been now working and speaking with our partners, with Sabre Trust and with Holy College Child of Education, to discuss ways to provide ongoing support to newly qualified teachers. So we're seeing training during the student teaching year is actually not enough to really change practice when teachers are placed by themselves in the country, across the country. And we're also talking about ways to expand teacher networks, that this kind of having another teacher to support each other during their placement year seems to be pretty important in impacting children's learning. So we're now making a bunch of adaptations based on these results. And that is actually all I have for today, but I will just say that we found the tool, the measurement properties were really good in both of our samples, so we felt really, and we saw a lot of concurrent and predictive validity, so we felt really confident in our findings, and we've been able to share them with our partners on the ground. So.